Welcome to Strategies for Running an Efficient, Valued, High Morale IT Shop, a health system CIO production. Uh, just some housekeeping before we get started. My name's Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, we're going to go about 40 minutes with our main panel discussion featuring Laura Fultz, Interim Chief Information and Digital Officer with Emory Healthcare, Ray Lowe, SVP and CIO with AltaMed Health Services, Shane Thielman, Corporate SVP, Chief Information and Digital Officer with Scripps Health, and Tanya Townsend, Chief Information and Digital Officer with Stanford Children's Health and the Lucile Packard Children's Hospital, Stanford. And then we will have our audience Q&A. So wonderful panel today, great topic. We want to be as helpful as possible to our audience, and we're looking forward to a great discussion. Laura, let's start off with you. You want to tell us a little bit about your organization and your role?
Yeah, so Anthony, like you said, I'm the interim CIDO for Emory Healthcare. I've been in this role for about 8 months. Prior to that, I was the Vice President of Applications and Digital Experience and did that for a number of years. Emory Healthcare is based out of Atlanta, Georgia. We're the largest academic medical center in the state. We're primarily in Atlanta. We're actually growing into more parts of the state. From an inpatient facility perspective, we've got 11 hospitals, hundreds of clinics all over the state, 70 different medical specialties, and about 30,000 employees.
All right, excellent, Laura. Thank you. Ray?
Good morning. I'm Ray Lowe. I'm the Senior Vice President, Chief Information Officer for AltaMed Health Services, located here in Los Angeles, California. I've been in my role for 8 years in January. And AltaMed, we're a large Medicaid provider. In fact, for community health centers, we're the largest in the nation with over 500,000 lives we take care of, primarily Latino, multi-ethnic, non-English speaking, many folks below the poverty level. So a lot of challenges that we face in terms of health equity and delivery. We also have PACE programs, like we're the second largest in the nation, which are all-inclusive care of the elderly, and we have a Medicaid health plan as well as an MSO. Thank you for including me today.
Oh, thanks, Ray. Appreciate it. Shane?
Good morning, Shane Thielman, Scripps Health, based in San Diego, California. We're a regional IDN, 5 hospitals, about 30 ambulatory sites, 3,000 affiliated physicians, about 17,000 employees. I've been with the organization for a little over 19 years and been in my current role for the last 6 years. So pleased to be here this morning.
All right, Shane, thank you. Tanya?
Hi, Tanya Townsend, CIDO at Stanford Medicine Children's Health in the San Francisco Bay Area. I've been in this role for just over 2 years, but have been doing the space of healthcare IT for a really long time. We are one large hospital, Lucile Packard, in the area. We're the only health network that's exclusively dedicated to obstetrics and pediatric care in this Bay Area. We actually have a large footprint of ambulatory practices, about 700,000 outpatient visits annually. We are a bit of a designation hospital in terms of certain specialties, so heart, and we are the only level 1 trauma center in the area for pediatrics, and we are affiliated with Stanford School of Medicine as the pediatric teaching hospital. So in my role, I cover applications, infrastructure, digital transformation, informatics, biomed, et cetera. So like I said, I've been here a couple of years, but been doing this for a little while. So I'm anxious to hear and learn from my panelists here.
All right, awesome. Great. All right, Laura, we're going to start with you. How would you describe the state of user demand and expectations? Have the dynamics changed over the past 5 to 10 years? And if so, how? And to what do you attribute any change?
They have. I think we will all say yes to that. Most definitely an increase in demand and an increase in expectation. So it's expected to be always up, faster, seamless, more integrated, and expected to make jobs easier, not harder. I think 5 to 10 years ago, IT sometimes was seen as more of a burden. So we would add clicks to workflow to be able to get a discrete data element to be in a report. And so, but we've shifted. And so now we're finally at a point where we're really becoming a value add. And so we're shifting from that being looked at as from a cost center to a value center. And I think why did that happen? I think some of the technologies just changed and evolved and improved, right? So that's where AI comes into play and ambient. I mean, these are things that are making people's jobs easier. And that's why it's such an amazing time to work in this industry. One other thing that I'll mention too is because of that high expectation that everything's always up, I think that's changed. Thinking of an outage that we had earlier in the year, an unexpected outage. And one of the things that we realized is that we have to do a much better job of maintaining business continuity and working with operations because it's a good problem to have, but it had been so long since we had had an unexpected outage. It was clear that people forgot what to do. And so our outages now, we just took a Epic upgrade and we were down for about 30 minutes. 5, 10 years ago, those would take 2 hours, 4 hours. And so people are more dependent on the technology and it's more up. And so when things do happen, we have to make sure that we ensure people know what to do in those situations.
All right, very good. Excellent. Ray?
So if we go back 10 years ago, I think there's a lot of focus on implementing your EMRs, whether it be Epics or whatever your choice was in your health system. You go back 5 years from the middle of the pandemic. I think that was an interesting time because everybody had a singular focus in terms of how we can provide care, which is, I think, a really kind of a unique time period where everybody really had that same focus. And you fast forward to where we are now, right? And now we're trying to do more with less. AI is the buzzword. Is it going to replace people? How is it going to help me? And there's a high failure rate in terms of AI activities. So I think as leaders, we have to be very thoughtful with our clinicians in terms of what we're delivering, how we're delivering it. Ambient clinical voice has been a clear winner in terms of improving productivity. But when we talk about like the back office productivity, how are we doing it? How are we training the models? How are we validating what's moving ahead? I mean, that's really kind of what we're looking at in terms of like increasing top line revenue or increasing productivity, right? But then how do you measure it is also the more interesting question because it may take a little bit of time to get there.
Yeah, that's a great point, Ray. We have to keep in mind that projects fail, right? Some projects fail, and we have to be careful about what people want to go forward with. So that's a great point. I'm sure we'll discuss that more. Shane?
Yeah, I mean, I agree with the comments from both Laura and Ray. I think the dependency on information systems and data and analytics has only increased and will only continue to increase moving forward. I'd say the demand is correlated to that sort of interdependency in terms of how technology is used to support care delivery and the support operations that wrap around care delivery. I'd also say that I think that there's an appreciation for what it takes to manage systems, at least in our organization culturally, and there's an important partnership that exists between clinical operations and the IT team, as well as business operations and administration. In that, in order to sort of define priorities, there has to be really a shared accountability for that prioritization and a really clear understanding of what the capacity limitations are, both within information services, but also in terms of clinical and operational change management. And so really focusing on prioritization and aligning those priorities to organizational strategy and operational imperatives, whether that's clinical quality improvement, safety, financial performance, addressing legal compliance, regulatory considerations, all of that becomes really important in terms of factoring in, how we make decisions about the projects and initiatives that we undertake, but also the day-to-day support that's really necessary to keep the systems functional and really supporting day-to-day operations.
Yeah, great stuff. Great points, Shane. We'll follow up on a lot of those. Tanya?
Yeah, I agree with everything said so far too. But my little bit of a different twist on it is in my 20 years or so of doing this, the one thing that has remained constant throughout my career is the demand. So no matter what, I've been trying to solve this problem. So, maybe that's when we get to the ask a colleague a question. But I've been trying to solve this problem of capacity versus demand for my entire career because that has been constant. No matter how many resources we have, whether that's people or funding, et cetera, there's always more demand than we can deliver on at any given time. We can't boil the ocean all at once. However, what I do think has changed over the years, which is exciting, is the pace that we need to deliver. So we no longer have the luxury, so to speak, of spending years on implementations and planning them out for, 18 months. It's the pace and the expectation to deliver quicker and faster and seeing results has changed. And I think the pandemic kind of taught us
Uh,
that we have to respond quickly, and we can. It really taught us that we can actually deliver very quickly when we have to, when everyone's focused and we all have the same goals at the same time. But I agree with everything else already said too.
yeah, it revealed that, wow, IT got that all done really fast. And people are like, why don't you keep doing things really fast? And you're like, well, wait a minute, wait a minute. So that's that great points there. Excellent points. All right. Next question. We're going to start with Ray. Um, okay. Many contend that today's environment is characterized by, and listen, here's the thing where I'm coming at with these questions about more with less, constrained budgets, and Lisa, to a bit of what Tanya said, I've been around a little while and I've been hearing this stuff forever, right? It's always more with less. It's always people want more. And I'm trying to understand and, you know, talk a little bit about AI, right? I ask people all the time, I say, is this fundamentally different? And I'll get different answers from really smart people. I'll get people that say, absolutely, this is fundamentally different, and they'll explain why. And I'll get people who say, it's just another technology. We know how to do this. So, different answers. Um, Long story short, I'm trying to understand if the environment we're in is very different than it used to be. Let's talk about it from a budgeting point of view. Are we in a mode where it's okay to spend on IT in order to save and reduce work? Or do people want budgets to come down or at least remain flat? So where are we with in terms of, the money that you have to work with? So Ray, let's start with you.
Yeah, so we're being a Medicaid provider, and with the outcomes of the big beautiful bill, and people being proven they're Medicaid eligible, and that they are documented and that they are working. So, we are forecasting a reduction in terms of our membership, which of course means a reduction in funds that are available. So working under that paradigm, you look at where are those investments, and we briefly touched on the ROI, but now the focus from the CFO and the CEO's office is what is that hard ROI? I can use an example when we look at scanning solutions. Epic has a solution out there called Gallery, and it helps in a number of areas in terms of unifying the node and the ability for it to crawl through, and there's other financial incentives on there. But then there's a people benefit where you improve the overall productivity of the HIM department. That being said, right, is where you currently benchmarked, right, and then kind of where are those opportunities where the work can be optimized, or staff can be optimized to do other things or really other areas. So my challenge is how I can do a financial pro forma analysis of an ROI of a system replacement. When it comes to the business opportunities of where and how their improvements, it takes a while, right? It takes us 6 months, 8 months to deliver it, and then they will see those other people workload benefits further down. So that's kind of like my lens as I'm looking at how we're doing things, and it's a constant conversation that I'm having with the other executives in the organization.
All right, very good. Shane?
Yeah, we'll absolutely agree with assertion that we're operating in a constrained environment with really significant headwinds as well, which I think is daunting, but it's also an opportunity. And I think if we kind of look back over the arc of digitization and healthcare and technology adoption, I'm not sure that if we compare ourselves to other industries that we can say that we've accomplished some of the same transformation outcomes that other industries have as they've undergone digitization. And I think this is really an opportunity for how we can demonstrate technology can be used to really drive critical outcomes for the organization. And what that's meant more recently is just an increased focus on the discipline of business planning as it relates to integrating new technology into the organization and tying that back to clearly defined benefits. It also means that there's an opportunity cost. You're going to do one thing and you're not going to do something else because of the limited resources that are available. And so how those decisions get made and how those decisions get communicated, I think, become very important. I think as well, there's a trickle down as it relates to sort of the kind of the staff skill sets and talents that are necessary to continue to advance and support how systems are managed across the organization. And that's required some upskilling. It will require some sort of cross-skill development moving forward as we have to find ways to do the same amount of work, likely with fewer resources moving forward. So, but I do think it's an exciting time in the sense that it really sort of forces the question, are the investments that we're making in technology, how are we translating those back to clinical and business value and doing that on a residual basis, which I think is a great call to action for us as professionals.
Shane, would you say it's almost a sense of having to grow up from a business point of view and just get more formal and much more structured around evaluating investment decisions as a business?
Yeah, I think that's a fair characterization. We've been on that, kind of that path over the last 4 or 5 years. But I would say with even more discernment and an increasing level of focus around really challenging assumptions. And I think to some of the previous comments, making sure that I'm going to say the bets that we're making, we feel really confident will deliver, the results for the organization. And I say we as the collective, whether it's from a IT leadership standpoint, but really importantly in partnership with other key executives in the organization that ultimately are likely going to have to translate how that technology is deployed into a very defined set of outcomes. And so that really unifies us in terms of what we're trying to accomplish and how to get there, which I think is really important. It also really addresses, I think, an important comment that Tanya made, which is the pace at which we work in order to achieve those results. And so it can't take years any longer, not just an implementation, but really getting to defined benefits associated to those technology investments.
All right. Thank you, Shane. Tanya?
Yeah, I feel like this particular question could probably take us the whole hour if we had that much time. But I think we're at a pivotal time of change around this topic because that we do have so many headwinds coming our way, and we are such an enabler, and we're a dependency. And so I feel like we've been modeling our budgets off of this historical practice of how we do our budgets. And I think that has to shift just because of everything I just mentioned with the growing dependency and the growing investments that we need to make to enable our workforce, to enable our organization for all of the ROI that we're talking about. And so that's what I think we need to start working towards is how do we educate our executive suite, our financial areas on why the budgets aren't going to remain constant or why they're not going to necessarily cut, or are there different ways that we should be budgeting? So if there is very clear ROI and who's going to be benefiting from that ROI. So if there's a specific area that we are going to be reducing the workforce potentially because we're creating efficiencies or avoiding additional costs, should the investment go to that department versus sitting in IT and we just constantly keep growing our budget and it's inflating year over year. And so there's a lot of education, and I think there's going to be a lot of unique ways to carve out how we look at our budgets. But I think this is a big challenge right now, that pivotal time, like I mentioned.
Yeah, and I think that's great stuff, Tanya. I did a specific webinar in the past on CIO CFO relationships and the importance of financial literacy among CIOs. And it sounds like this is going to be more important than ever going forward. You need a deep, deep understanding of accounting, finance. You'd better have a good relationship with your CFO because you need to have these discussions. If you don't have a certain depth of literacy in this area, which I completely lack, you don't even know what to ask. You don't know what the possibilities are. You don't know how things maybe should be being done differently. So this is an area, as I hate to use the phrase, everyone should lean in as technology leaders and level up, another horrible expression, level up on their knowledge. Does that make sense, Tanya?
Yeah, definitely. And yeah, everything you just said, I completely agree with.
Awesome. Laura, what are your thoughts?
Well, it's interesting you talk about the relationship between CIO and CFO. I think that's one of the reasons that we created the role of CFIO, so Chief Financial Informatics Officer, because that role and that office has been really important for us to build together ROI. And so the person that we have in the CFIO role is a surgeon, so she's a clinician, but really understands the financial aspects of the clinical workflow. And so her office, in conjunction with our data and analytics team, our user experience team, they will partner with finance to build an ROI on potential projects. And the fact that you're doing that with finance ahead of time has been really monumental for us, because it's not a trust us, here's the ROI. We went ahead before anything got started. We went with finance and we built something together. And so, and then, Tanya, you mentioned something interesting too about where does then the shared on the
Mm-hmm.
ROI, where does that go? Where we've sort of landed on is that we split it. And so, but again, I don't want to necessarily be brokering that. And so that's where the relationship with the CFO and that department comes into play. And so it takes both parties. It's not fair to say, well, it's an IT implementation, so they should reap all the profits gained. But it's also unfair to say, well, it happened in this department and they did the work. But, well, you wouldn't have necessarily gotten that ROI without the technology. So that's where we sort of land and we sort of get shared. And I will say it's not like a bank where we're, splitting out 50% here, 50% here, but I think it's awareness at a more senior leader level of, was this beneficial and why? And so each area gets to kind of share and the benefits of that technology.
Excellent. Excellent. Great stuff. All right. Next question. Shane, we're going to start with you. From a best practices standpoint for running an IT shop, please discuss the following. These are certainly not an exhaustive list, but just some things here about disciplined governance. We talk about, right, this goes with capacity management, right? First, you have to understand what your department is capable of in some way. What kind of output of work are we capable of? And there's going to be all sorts of nuance in that. And once we have an idea of how much the entity of IT can produce, it's, well, what should we be working on? And that's where we all say the business should tell us what they want us to work on. And we get into all nuances there around, well, how much should you lead and how much should you follow? You don't just simply want to be an order taker or you're not bringing a lot to the table. So there's lots of nuance and interesting in there. Transparent communication about these issues of how much work we think we're capable of, and then what we happen to be working on at any given moment based on what governance has decided we should be working on. Here's where these things are. Here's where your project is, Mr. Surgeon. that you've requested. Here's how it's doing. Here's why you haven't heard from us in a while. A nice dashboard that people could log in would be lovely, right? So we all want, everybody wants to build bots now to interact with bodies of data. I just wrote a column today about this. Everybody wants to build the body of data so the bot can, so I don't have to answer your question, right? I don't want to be in between the body of data and you anymore. I want to build a bot that lets you query the body of data, but there's all issues around curating that body of data, which is extremely interesting. So transparent communication and then proactive workload management. I'm not even sure I know what that means, but it sounds really interesting. So Shane, we're going to start with you, wherever you want to jump in.
Yeah, well, thanks. I guess the first thing I'd say about each of these, governance, communication, and workload management, is that I don't see them as independent of one another. They're really tightly connected in terms of the way in which IS relates to the organization. And I would say that as well, these are really ingredients towards a successful partnership between the IS function and the organization at large. And so at Scripps, we spend a lot of time really focused on all three of these. First and foremost, I think governance really is helping to set priority. And it's a place where the available capacity of IS can be communicated, can be conveyed in hard data and information. I think that is understandable from the business perspective and becomes really important ultimately in how decisions get made collectively between the organization and IS. I think another key takeaway. I find that I spend a lot of my time with a focus around communication. Communication about what is happening within the department, to the department, but also to the organization at large, whether that's at the executive level or across operations. And I really ask that of my direct reports as well, because I think it's critical that IS isn't perceived as a black box, that it is that there's an accountability to really supporting, the mission of our organizations, which is really around patient care delivery. And so we spend a lot of time really talking about what are we working on? What are some of the results that are being generated and created based on the work that IS is supporting? And I think that focus on measurement and outcomes becomes really important in terms of really moving away from a technology discussion to one of enablement. And so I really, as I'm kind of looking at the screen and just thinking about each of these, I see them as really tightly connected and interdependent. And a big part of what, I think as an IS leadership team we do on a day-to-day basis is make sure that we're, tying those elements together in a way that is consistent and digestible for the organization.
Very good, Shane. Thank you. Tanya?
Yeah, that was all really well said, Shane. I don't think I have a whole lot to add there. I agree, they're completely all interaligned with one another. Just a couple other things to add on from a governance standpoint. Something that's been really helpful is to partner again with the right operational leaders so that they are a partner at the table, helping us drive and helping us to make sure we're working on the right things. So all of our committees that make up our governance framework have the chair as a member from operations, and the co-chair is somebody from within the IT department. So it definitely helps them with some accountability and making sure that we're working on the right things and driving towards the right priorities. And then once we do agree on what we're going to be working on, that transparent communication is definitely key as well. And that's something that I've been really focused on is how do we continuously hold ourselves accountable to delivering where we're at? How are we doing from a status reporting standpoint, whether that's through newsletters, through dashboards? And I agree that needs to be internal to the IT department as well as external to the organization for that transparency. I think somebody mentioned bots, and we are working towards adding bots into our ServiceNow application so people can have real-time tracking of where their project is at. From a workload management standpoint, this is back to that question I said earlier. I've been trying to solve this for 20 years now. But how do we figure out the right balance of project work? And of course, the definition of a project is a whole other animal to tackle. But how do we balance projects versus ongoing day-to-day support? Because they're both very important. We don't want to just be working on the shiny objects, so to speak, and have outages or downtime or not having good customer service and managing our incidents or even requests for optimization in a healthy way. So that's the other conundrum I've always been working towards understanding is how do we balance that? And I think it changes or shifts depending on the organizational priorities. So completely agree. These things are all intertwined.
All right, excellent. Very good. Laura?
Well, these answers have all been very good. It's getting hard to add
Come
anything
on, you got something, Laura.
additional, but
You
I've
got
probably got
something.
something. So, we're actively working at it, and I won't say re-engineering, but on our governance process, one of the things that we heard is we don't understand it. And so we want to make it simpler. We've got to make it simple for our teams, and we've got to make it simple for the business to understand what does it mean? What does governance even mean? And you can do that through communication. So 100% agree with Shane's point is that, in order to be successful, you've really got to do all three of these things well. And so that communication can come in different forms. You mentioned dashboards. One of the tools that we've added recently is an enhancement tracker, because Shane also mentioned that black box, and we had heard that from time to time, and so I sort of challenged our teams to say we need to come up with a tool that simply shows people where the request is,
Mm-hmm.
in a way that isn't necessarily showing how the sausage is being made, but in a way that resonates to them. And so just simple categories that it's being assessed. It is on hold, it's in progress, and then it's being deployed, right? And so and teams can interact through the dashboard to get clarity on where it is, which team, it's clear on which team has it. And so we've rolled that out in the last month. That's been really successful for us. Um, the only other point I'd make on proactive workload management, I think it's the managers that are key on this. And so we're really working this year and into next on improving any kind of tools that we can do with our managers that are managing the people doing all the work. That's the hardest job I think there is middle management, right? Because you're representing the people doing the work, and then you've got to represent leadership and kind of share and get people to understand why certain decisions are made. And so we're investing in those folks. And then the last thing we're looking at doing is subspecializing some of our teams. So we are fortunate enough now to have some depth on our teams. And so we really feel like when we can subspecialize based upon the type of work that people do. So we're starting with the growth team. So a kind of a small ninja-like team that's all cross-trained. I think Shane talked about cross-training folks, but they work on facility-based projects. So whether that be an acquisition or even just renovations in a hospital. So they're going to get really, really good at that type of work. And then we'll move on to a run team and a transform team. And so when you have a subset of people working on the same type of work, I think you're going to be able to get a better feel for what's coming, and you can be more proactive. Right now, our teams are spread across sometimes 10 plus different initiatives, and it might be keeping the lights on work to a new project, to a new acquisition. and they're spread too thin, and there's too many variables that come in. So we're hoping that's going to be a way for us to allow us to be more proactive and more efficient.
That's great. Excellent. Ray, what are your thoughts?
Yeah, again, hard being number four, but I'd also add, it's really strategic alignment to the overall strategic plan of what's happening in the organization, where we headed to. As technology leaders, we know more about how the business runs and the business at sometimes and how all the hooks go into it. So that leads us really to operational excellence and how do we remove friction, for the business so we can, have operational excellence initiatives to streamline more for a group practice. For me as well, I have a very close relationship with my clinical informatics. It's actually part of my organization. So I have physicians, nurses, pharmacists, et cetera, on the team, and they work very collaboratively with the respective business units, right? And so we do assessments of what is coming up, right? What's coming up in Epic? How do we use it? How do we leverage it? We're able to float that in there. So when we lay over what is a strategic vision plan, what do we need to do operationally, it kind of builds our framework in terms of how we as an IT enabling will work. Now, of course, then we go into governance, right? And on communications, and we've discussed this before, we do a monthly IT report on all operational metrics, cybersecurity, project status. Quarterly, I publish it out broadly as well as putting it onto the IT SharePoint so that it's visible, so people can see what have you done. Where is it at? Really making it easier for folks to understand in terms of what's happening. And then on the workload management aspect, I think it comes back to our discipline. There are lots of people that have lots of really great ideas, and we have to stay true to the charters of what our governance committees are saying, right? And remind them this is what we said we're going to do in governance, right? And this is what's been approved. So we kind of keep folks aligned that way instead of being, whipsawed around.
All right, very good. Excellent. Thank you, Ray. All right, let's see what we got here. Communicating business value, we kind of covered that. Transparency for stakeholders, I think we covered that. Well, this is communication. Um, that's important. So let's talk a little bit about that. Uh, and let's assume we have a very influential user who's requested something, and we're not gonna we're not gonna be able to. How do you communicate? I think Laura, did you reference the idea that some people didn't understand the governance process?
I did, yeah.
So that may come into play here. Um, Governance is the tool by which you get to say, not now, or not the way you've asked, and here's how. But if it's confusing, it doesn't really hold as much validity with the person who's being told no, because they're like, well, I don't even understand all these committees, and you have 7 committees, and nobody got back to me forever, and now you're telling me it's not happening.
That's
And do
right.
you know who I am, by the way? Which I throw out all the time. I use that line all the time. Um, so let's start with you, Laura. You need to not be the one saying no. You need governance to decide what's going to be done. Um, how do you couch that so it's taken as well as it can be?
Yeah, we do it in the way that our governance is laid out. So we're sort of bookended by committees, both in the beginning and in the end, that are run by operations. So, the first and to simplify, I talked about how we needed to simplify our governance, and we're getting there. So, I mean, in its simplest state, I would say there's three main areas of our governance model. There's what we call CCGs and BCGs, so clinical consensus groups and business consensus groups, and that's where requests first go and are vetted. So if there's a no, and I'll be transparent that there's not a ton of no's, but there are some. A lot of times it comes out of that spot because those are going to be things, well, this request doesn't make sense, or we already have something that does something similar, or we know you guys are about to do something that's similar. This doesn't make sense. So the benefit to my group is that those committees aren't facilitated by IT. It's facilitated by an operational leader. And so they are the ones with the lovely task of communicating that back to one of their colleagues. But it works out quite well. So I will say that IT sometimes does say no. And so in those situations, it's because of things like a security or a technical review.
Uh-huh.
But we're working really closely with the requester at that point. And so it's typically, if we're going to say no, it's in a pretty egregious situation of like, it's just not safe for us to work with this vendor. Um, at the tail end, we have what we call experience councils for, that focus on the patient experience or the clinician experience or the financial experience. Also chaired, it's jointly chaired by a member of IT and an operational leader. And so that's typically where you're going to get the not nows.
Mm.
Because they're helping prioritize. So the middle layer of our governance is we've said in the first spot of CCGs and BCGs, should we do it? Then we get into informatics that talk through how do we do it? And then that's a partnership between our application teams and informatics that kind of figure out how and then propose when we could do it based upon availability. That information is presented to the final step, which is our experience councils, which are sort of looking at the holistic view of that patient experience, clinician experience, and they're helping us prioritize. So the not now then comes out of that group, which again we ask for our operational chairperson to deliver those messages.
I don't think I want that job, but you can, that's, that sounds good. Ray, what are your thoughts?
And building on what Laura is saying, I would say that we should be providing options, right? And they're going through the governance and review cycles that are out there, and often an option one could be current state, which is a very polite no, an option two or three. And the way that I kind of look at that and looking at how we're approaching it is that's why I present it. And then if somebody asks me, what is your opinion, right? I will give my opinion. But I really think that we have to educate, give them the options and the cause and effect, right? Again, following Laura's governance process as well. And it's fairly clean. If you're in committee, a tool that I've done, I kind of do like a thumbs up, sideways, up or down, and people can approve it, live with it, or not live with it, right? So we understand where are the dissenting voices and what do we need to address for other concerns. But that's the approach that I use, again, following Laura's model as well.
Very good. Tanya?
Yeah, not a lot to add either, but well said already. But I would say one of the other challenges to navigate around this topic is the culture of the organization.
Mm-hmm.
So I would say how I answer this question would be different from one organization to the next, and a lot is based on culture and how well we as CIOs are supported from the organization standpoint. If we're kind of an island on our own, it's difficult to navigate the no or the not now. However, if you're in an organization where you are well supported and you're part of that executive suite team and everyone's on the same page, it's a very different answer. So I think it's also challenging for us as CIOs and for our leaders. I think Laura said it well, with the middle managers have the toughest part of these conversations because they oftentimes are stuck in the middle, and we are very much a service-oriented support department at the end of the day. So we want to say yes. So I like how Ray mentioned options. So how do we get the expertise around negotiation, the art of negotiation? So maybe it's a not now, or maybe it's an option around scoping. And we all know that project management triple constraint is we can negotiate either the timeline, the duration, the resources, or the scope. Like we can do any of that, but we can't do them all three at the same time. We have to really negotiate around that. And then again, this is varied from organization to organization, but I've been in places that cringe at the word governance. I wasn't allowed to use it in another organization. So I find it validating that all of my peers are using this word and we all like use it in the same way. But I wasn't, I was not so supported when I used this word in the past. So we've flipped it to now be called partnerships councils. So like I said, we now have a chair and a co-chair that are representative of IT as well as the business, and we are truly partners at the table to negotiate these things. And the one last comment that we try to focus on too is really trying to switch the conversation from what are we not doing to highlighting what we are doing. So let's make sure that we're doing a great job at celebrating our successes and communicating that across the board, because success breeds success. So that's what we want to do more of, is getting champions to help celebrate what we are doing instead of focusing on what we're not.
Yeah, Tanya, just to follow, it's a great point. And we've also know the issues of keeping the lights on and how much of an IT budget can be going towards those things, right? You could have, I don't know the percentages, but could it be tremendous number that's not going to anything new or anything fun? It's going to keeping the lights on. You talk about the uptime, it'd be almost 100%, right? So that needs to be communicated. Like everyone needs to know that, hey, yeah, you might see somewhere how much money IT is getting in this health system and go, why isn't my project done? Or why can't I get this little piece of software I wanted at a conference? And it's because 80% or whatever crazy number is just to keep the lights on, folks. That's got to be communicated, is my point. What are your thoughts around that,
Yeah,
Tanya?
yeah, no, completely agreed. It's kind of the question I asked earlier too, because this might vary from organization to organization. But yeah, how much time do you spend on keeping the lights on? And you're right, I would say it's about 80%, because it's not just like the incidents and care and feeding. It's also optimizing and supporting those systems. It's not always the big kind of sexy big projects that
Yeah,
take up our time, but that does tend to get a lot of visibility. So you're right. How do we educate and partner with the organization to understand that underlying support requirement? And it kind of ties all the way back to budgets. Like that,
yeah,
a big part of our budgets is the care and feeding and support of the things that we buy. Um,
right.
so then we can get into application rationalization and all those sorts of things, because we can't just keep adding more and more and more to the same group of people. So it's a delicate balance.
And the communication is extremely important because we may realize that we need to communicate this to everyone and let them know, but if we put it in an 85-page report that we send out in a PDF, no one's going to look at it. So, right? So there's that last mile of communication where marketing and partnering with different departments can come in and say, here's what I need the organization to know. Help me understand how to get that in a digestible way. Anyway, that's just my thoughts. Shane, what are your thoughts?
Yeah, fantastic comments. I think my additions would be one, the importance of getting to a decision. Ambiguity, I think, impacts the sense of transparency that we've all emphasized as being so important. And oftentimes, no or not now is not a popular decision and message to communicate, but it is important to, I think, maintaining and continuing to build trust. I think the other thing that maybe I would add that hasn't been discussed is the answer can be yes if there's joint agreement that something else may need to come off the list. And I think we all deal with, the planned activities very well. It's the things that come up. They may be strategic in nature. They may be a need to react or respond to a particular environmental situation. In the organization that suddenly requires sort of rethinking the portfolio of work that a team or a set of teams are working on within the department. And oftentimes that results in a need to go back to the business and have a conversation around either slowing down work on other initiatives in order to reprioritize, or if there's some sort of compelling reason to introduce something new that wasn't planned and is time sensitive, what can we put on hold? I think that exercise is one that I feel like we're doing. I wouldn't say routinely, but we are seeing that occur on an increasing basis, largely to be responsive to strategic and business opportunities that are presenting themselves that may not have been planned at the outset of a given fiscal year, but need to take precedence. And so I think that's the one sort of spin or addition that I would add to the question is, how do you sort of manage the work in progress when something new is introduced that really absolutely has to take a priority, and how do you manage that, with stakeholders so that they understand the new business prerogative and what it means for their project or initiative, either in terms of a temporary hold or may need to sort of take a back seat for an extended period of time.
That is such a good point, Shane. And we're doing a lot. I'm doing a lot of laughing over here about the poor people that have to communicate bad news, and this is an even less pleasant scenario of, hey Bob, you know how I told you, we everything was moving along on your project. Yeah, not so much anymore. Or even better, we could just change the little message in their dashboard when they log in to check their project that says on hold. Wait a minute, what happened? What happened? But then, Shane, is what you said. You have to explain. Oh, by the way, we just acquired another hospital, so there's a few things that are going to have to go on hold. So, but I would like to make this our final thing. I want to go around the horn and get comments from everyone on Shane's sort of question. We'll make that our one ask a co-panelist question. This idea of things coming up. We talk about the idea of fires in IT all the time. There's a classic book I read a while ago. I think it's called The Phoenix Project or something, where, right, the idea was you can't run, this is the reality, but it's very hard to run a department, a service department that is reacting to fires all the time. I think the whole point was that the CIO in question or the CISO needed more support. They weren't getting defended at an executive level. They weren't having their department defended from having work dropped on it randomly. And it's very hard to run a department that way. So, but it happens. As Shane said, things are going to come up that require reprioritization and remessaging of things that had been communicated in a not favorable way to those receiving the information. So let's go around the horn. We'll make that our final point. What's your thoughts on this issue and your best advice? Tanya, we're going to start with you.
Great. Yeah, no, that it is a great question. And I guess I'll use the pandemic example again. I think it was something that we can kind of capitalize on as far as like lessons learned and how we leverage that example into the future, because it was the example that we all have. We all had the same experience where we did have to completely pause on all of those beautiful strategies that we had underway and had to stop and shift. And the value of that experience was that partnership. The whole organization was all on the same page, and everyone was working towards the same common goals and initiatives. And at the end of the day, it was taking care of our patients and taking care of our communities. So that was, how do we kind of take that experience and leverage that for how we handle future examples like this, like making sure we're all on the same page.
Very good, Ray. Your thoughts?
Yeah, I think it speaks to, agility and nimbleness in terms of our ability to, flex and go in a new direction. But I think the also prioritization cascade, from the executive suite is very important for the alignment. It diffuses those type of questions that could come up. And I think the other area is you never want to waste a good crisis, right? So if you look at a cyber initiative or a significant technical thing that happens around there, the business often forgets, IT is like the phone company. They forget what we do until there's a problem. But when something becomes forward and right in front of them and they see they can't provide care or they don't have good downtime or we need more investments on cybers, that's the time to go hard, go fast, and be very clear in terms of your ask, right? So we can ensure that we can deliver the care. So
Excellent.
just a few of my thoughts.
Very good. All right, Laura, we're going to give you the last word today.
Yeah, I think on this one, it's all about relationships, right? And so Tanya sort of mentioned that. And so using those relationships. So when something comes up and work has to shift, you've got to work with your business partners and hope that they understand. Find alternative ways, sort of like water. We will always find a way. And so, is there alternative funding sources? Is there work that we can scale down while we work to scale other work up? It's really using, everything we've talked about, communication, effective communication, so people understand the why. So it's not like, I'm sorry, just to your point earlier, we can't work on your project anymore. Sorry, you've got to use the relationships that you have with the crisis that came up, with the person that's impacted, with your, whether that be clinical informatics. So the bridges that bring that together to make them understand the situation, and just keep working to see if you can find the best solution when you're in a bad spot.
Excellent. All right. Listen, that was an absolutely brilliant discussion. Wonderful talk today. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand recording is ready. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team and go to our webinars to register for upcoming panels. With that, I want to thank this tremendous panel, Laura Fultz, Ray Lowe, Shane Thielman, and Tanya Townsend. And I want to thank you, our attendees, for joining. And with that, everybody have a wonderful day. Thank you.
Thank you.